Yeah, loose, baby.
We're about to go and make this vessel with these great professionals in public glass. We're not part of the community, but we're from the outer family of glass blowing. Yeah, we're gonna go make a magical giant jar with optic lenses so that if you turn it, it changes all the time. So if you change the way you look at things, the things you look at will change.
Hey, oh, that's so cool. That's so much fun. Great little intro. So that's the making of the jar that holds the questions for the Jar podcast. And basically the Jar Foundation, this show, so welcome to Mental Health Today we got Lauren Sumrell, right, with us today. Thanks. Thanks, Lauren. Thanks for being a guest. Thanks for taking your time out. So everybody, this is a show really about all things mental health and really bringing different guests on from different disciplines within the mental health space to kind of educate me in a way and really give a platform for everybody. And then also obviously for the listener. And so mental health is something that's kind of come, into my life via way of the Jar podcast. And I got a real passion, I think, to help people, also giving people space to tell their story on the Jar. And I think probably, giving people some kind of resources to help sort out the mental health crisis across the country, and like in the little pockets. And Lauren's got a really cool, background. I don't want to spoil it because I'm gonna let her go into it. But Lauren, I think I'm attracted to your background because you've done quite a bit in this space, right? You've been around into different spots, interesting angles to view it. You were a consultant. I think that's kind of cool because that gives you all kinds of different eyeballs. You get to see a lot.
Yeah.
Without really spending too much time on something. But now, great stuff. I think what you're doing is cool. And maybe you can share a little bit about yourself and, your ahas and what you're doing.
Yeah. Thanks, Ken. I'm really glad to be here. So thanks for the opportunity. A little bit about me. I started out in the healthcare space working for a large hospital system. I kind of grew up in the project management world. So that's where I cut my teeth. And I learned a lot about, how to thrive in large organizations and how to be really organized and deliver well. I spent some time in the insurance sector. I spent some time in the government sector.
Mm-hmm.
And then ultimately I've ended up in the telehealth space. So I spent 5 years at a large public telehealth organization, largely in the operations division there. Great experience. But ultimately, about this time last year, I was going through what I think a lot of people have gone through since COVID, right? Just that burnout. What do I have besides work? What purpose does my life really have?
Oh, no, not that one. Not that question.
Like that heavy, big question, what do I do? And I sort of had this break of like, I am doing something that isn't ultimately helping people that need it the most. And so I took 30 days off. I took a brief leave from work. And I really spent a lot of time alone and reading and writing. What does this mean? Like, what do I do next? And so I gave my notice. I didn't go back to work. But not too long thereafter, I found SESH. And I talked a lot to our founder and CEO, Tori LeCompte, about what SESH is, why she founded it. And I just sort of fell in love with the passion the people here have for the work they're doing. So I've been at SESH almost a year now, leading the operations organization. SESH does digital group support. So, not one-on-one therapy. We use licensed therapists to facilitate our sessions, but it's in a group setting. So, I really believe in what we're doing, and it's made a world of difference in my own life personally.
Oh, that's so cool. We were talking about how people now are probably so much more receptive to a group setting after staring at all these faces on Zoom calls over time.
Yes. Yeah. I think, 10 years ago, SESH couldn't have thrived like it is today because the concept was so far and away from anything that was
Yeah,
existing, right?
absolutely. For
It's like
sure.
there's no comparison. I mean, there were AA groups you could go to in person in a church somewhere,
Yes. Yeah.
but there just wasn't that translation to what we have here now.
And I mean, you must have done a ton of surveys, either with with the current guests or people like just random, random people. Would they
Mhm.
be, would you? I don't know how you'd find people, but focus groups.
Yep.
What does it? What does it say? I mean, what can you call? What can you say? It can say. I mean,
Yeah.
what people
I
say
mean, I
about.
think you're asking about what differentiates SESH, right, as a service for people who have a mental health need. And to me, that the differentiator is we can service people on both sides of the continuum of care. So people who are kind of just dipping their toe into mental health and
Hmm.
curious about like, could this help me feel better? All the way to
Oh.
the other end of people who are like coming out of inpatient services and they need in-person care and they need group
Oh.
support and coming around them with all of these services. So I think that's a key differentiator for us, as well as just our flexibility. You can come to us any day of the week, any time of the day, variety of topics across, depression, anxiety, stress, trauma, grief. We service all of those needs, and it's in a safe place. It's a safe place because there's a licensed therapist there
In there,
facilitating.
yeah. So this is a pretty cool because one of the big ones is stigma, right? And people worried about,
Hmm.
what is it like? You
That's
know, what,
right.
and if you get somebody new and they can kind of, like I said, be a fly in the wall sort of
Yeah.
in a session and
Yeah.
watch other people jumping up and down, not jumping, jumping up to the stage, kind of not jumping up and down, kind
Yeah.
of getting in conversations with, I don't know how it goes, but with the therapist and then I guess with other people
Yeah,
commenting.
the therapist usually opens, right, with a prompt or a question or an
Okay.
exercise of some kind, depending on the topic, just to get the conversation
Yeah.
rolling.
Yeah.
And Ken, what you're saying is exactly right. There's some people who are going to come and the healing really happens from talking it out. And there's some people who are going to come and they're less quiet, but the healing comes from just knowing I'm not
Yeah.
alone.
Yeah.
Other
Yeah,
people
totally.
feel the same way as me.
Yeah, and they're
Yeah.
listening to like
Yeah.
because we always say there's people going through the same thing you're going through, right? It's a common
But you can't necessarily find them at that exact moment.
right. And now all of a sudden I'm hearing somebody saying, "Oh my God, that's exactly how I feel." I could see where
Mhm,
that is that's
mhm.
maybe more
And it can
powerful than
be
yourself.
it can be somebody at a different stage in the journey as you. So, for example, in our grief sessions, there could be someone who's just experienced the loss of a loved
Oh,
one, and there
yes.
can be someone who's like 5 years down that road, and they're really pouring truth into you saying, "This does get better. This does get easier." And they're not lying, like they've lived it.
Yeah, and they've
So,
been through this. Yeah, we're talking I think the other attraction is that we were talking about community, right? Communities are not
mhm,
as common, we're not as community driven, right? There are still, I
yeah,
think churches do their best job, spiritual groups. I mean, in some ways, yoga groups, but they don't,
sure.
but they don't get into it's healing for yourself. I don't know that they get into groups that, whereas a place where you have a community like this, where you can go any time of day, it's
Yeah,
crazy
yeah,
on any topic, and you can jump in and hear other people on on their own journey,
yeah, yeah.
right? Like you
And
said, on
it's
their own journey. That's super clever. This is a clever idea.
Yeah, I can't take any credit for it. I mean, I'll just give a quick shout out to Tori. She had an eating disorder. She went to an inpatient center, and she'll tell you herself the most transformative part of her healing came when she started going to groups. And she
Yeah,
thought,
yeah,
I need to
totally.
bring this to the masses. I want this to be available, low cost, no access barriers to everyone. So,
Yeah, and so I mean, I guess that is one question. So if it is one therapist and you've got a bunch of people, the cost
mhm.
is impacted as well.
Yeah, it's distributed. So what's so crazy, and I'm sure you know this, Ken, but I don't know if all of your listeners know, like the cost of therapy today is so prohibitive that even the people that truly need it can't access it.
Yeah, yeah.
Even with insurance, you can have insurance benefits and it can still cost you $50, $100, $150 per session, depending on your insurance, depending on your location in the country, which is just terrifying. And Sesh offers, unlimited access to our direct to consumer members for $60 a month, unlimited sessions for $60 a month. Yeah. It's crazy.
Yeah. And that brings, like you said, that brings it to a much closer, like I said, any time of and that's, I look at how much time it gets. You have to go there, right? You have to
Yeah.
go to the place. You have to wait. And I think, if you can get inpatient and that's what you want to sit with somebody, that's pretty powerful. But I could see people doing that and this, like even having
Yes. Yeah. So we surveyed our membership, and
totally could see both.
Two-thirds of them we call them the worried well. They're not going to one-on-one therapy already, but the other third, they're going to one-on-one therapy and using our groups.
Yeah, totally. I mean, it's different stuff.
Yeah, it's a different way to heal, and it's, you can get from your therapist, here's some clinical guidance, here's a care plan, here's some homework, but you don't have a room full of people saying, "Ken, I've been there."
Yeah.
Like these are the things that helped me when I was in that moment.
Yeah, and go through it, follow your therapist, you're going to get better. I was on the same journey, it takes a while. I could see that would be pretty comforting. You got to put the work in.
And you got to show up, right? You can't mail it in. You still have to be there, be in a quiet, safe space and listen and hopefully engage. But yeah, it's pretty easy to do.
How do you guys distribute? How are you, what's the model or the plan for, getting it to more eyeballs and finding more people?
Yeah, great question. So we have a mobile and a web app, but the app isn't our service. The app is just the doorway to the service. So seshgroups.com, or if you look up Sesh on your mobile device, you can download the app and browse all of the sessions that are available to you. You can look at the facilitators we have in our network. You can filter by day and time, topic. But as a way to get more members in the door and to help more people, last year we really started to focus on that B2B marketplace.
Yeah,
so
and just was wondering.
Selling Sesh is a benefit to employers for their employees.
Yeah, and then you can even do something with pricing as well, because you're not going to have that.
Right.
Not everybody will use it, et cetera. So you can really break the cost down.
Right.
And $60 is still $60. But the value to an employer, I mean, I've seen some studies that the benefits to an employer.
Huge. You're reducing burnout. You're increasing productivity. You're decreasing churn. We can give you, as part of our sales program, an actual tangible ROI we project you'll get from using Sesh.
Yeah. I mean, it's kind of a crazy thing to not have. And almost crazy to think you wouldn't even just it's within 10 minutes of hearing the presentation.
You're like, that actually happened on Friday, Ken. We were on a call with a leader of a charter school, and we got halfway through the pitch and she's like, I don't need to talk about this anymore. Like, we're doing it. We need to do it. And I was like, really? I was like, great. Let's do it.
No, we want to finish our sales presentation. You're not buying until I ask you to buy.
Yeah, it was amazing. She just got the need. And I think, unfortunately with what happened in Nashville last week, there was that, pressure, right? Of like, I need to give my staff something now. And we can do that. We can turn it on within days. So.
Yeah, it doesn't, I'm sure that doesn't take much.
No.
I think the workplace is there's been a couple companies I've talked to that are doing things, and the workplace is a great spot to go.
Yeah, and I think we often encounter this feedback on first calls sometimes with larger orgs where they're like, well, we already have an EAP that offers, we have an EAP, we have that. But if you dig into what that EAP benefit is, Ken, it's limited usually to 4 to 6 sessions per year. You probably have to wait 60 to 75 days to get hooked up with a therapist that's in their network. And what if you don't like that therapist? then you have to start all over, you know?
Yeah, and there's no, yeah, I don't think that like you said though, it's good. It's a good kind of a brush people off, but as soon as you look at the depth, agree.
Mhm.
There's no real meat in an EAP.
That's right.
Um,
That's right.
it's a little window
I
dressing,
agree.
tick the box. We got an EAP.
Exactly. We have something. Okay, but is anyone using it? How hard is it to use?
Yeah.
Yeah.
Yeah,
Yeah.
and like you said, the copay, and can you find somebody in the net? This is a common thing that people are trying to solve as well in the space, which is in the network and out of the network, and and how
Mhm.
to bring more. And I don't know how that's not going to be easy to solve, because the mental health crisis is getting bigger,
Yes,
and
every day.
I don't think the rate of clinical psychologists and doctors, therapists is growing at the same rate.
No.
So I think the gap. I saw some. You probably know the stats, but I saw some stat that said something like 28% or 27 point something is the actual number of therapists per population. You were
That
20.
sounds about right.
You were
Yeah.
about one third of the requirement.
Yeah. And it depends on the area of the country you live in, right? That could be better in some places and way worse in others
Yeah.
too.
Oh, yeah. There were some
So,
states that it was like 5% or 2%. Like
yeah,
literally, there's
not a
10 therapists in the entire state, and they're all in one city.
and not to I admire these clinical leaders. They are truly bearing the brunt of everything that's going on today. But think about, like, do you really want to be just another number in someone's weekly schedule? They've got 40 clients this week. Do you want to be that, or do you want to be a part of a team of
Hmm.
therapists and a group of your own peers who they're not already burned out?
Yeah, I think it is tough. I did a live show with a friend of mine last week, and his wife is a therapist, and he's saying, there's some, and she's a such a good person, got such a big heart. I think it's hard for people to turn work down.
Oh, yeah. Oh, yeah.
It becomes, because you are trying to, you see how many people really need the help, and you probably see that you can help people. So you're actually
Right.
like
You've got
I'm
the tools.
right. I
Yeah.
got the tools. I'm helping people. It's just a couple more hours. I can do one more patient or two more this week or whatever it is. And at some point, there's an endless supply of
Yeah.
people that are coming over the hill looking for, that need help.
My
Um,
mom is a licensed counselor. She's been trying to retire for 3 years, and she can't because she's like, "Oh, I'm just gonna keep these couple. They really need me." And I don't know. It's hard, I think, to just shut that nozzle off.
yeah. Oh yeah. And I get it too. Cause I was talking to somebody. I did have again another guest, and and he was saying he had just started to get going with this one therapist. And he's like, and she abandoned me. And like he
It's
took
not
it
funny, it happens,
he
but
took it seriously
yeah.
personal. Like he
Yeah.
took it very personal, and so I could see where, like, as a client, right, as a patient, you're like, we just got somewhere, and then you've
You're like,
abandoned
"I'm
me,
gonna start all over? Like,
right?
I've told you all my deepest, darkest needs, and you're leaving me, and I have to start over with someone new?"
Yeah.
Yeah. Yeah.
I've totally felt it for him, and I'm like, and I can imagine, I'm sure she had her absolutely important reasons. Um,
Yeah.
but so I could, that's tough. So I think this is a great, like I said, a great way to dip your toes and get started. The cost seems to, very much affordable, especially when you consider what we
Mhm.
spend money on. And man, if you can get the employer to pay, if we can get
I
the,
know. I know. I was at a conference last week in Vegas, the Transform conference, and there's a lot of HR leaders there, decision makers, right, for
yeah,
benefits, and anyone I had the chance to speak to, they were like, "This makes sense. This just
yes,
makes sense." I'm like, "I
yes.
know. That's why I'm here telling you about it." Yeah.
Yeah, very funny. And where are you out of? Where's it out of?
Yeah,
You guys are,
sessions, we're fully distributed team, so we've got people all over the country. Our founders in right outside San Francisco Bay Area, and so yeah, we work remotely as a team.
and what other ideas? So what's next? I mean, you've been doing this. I mean, the company's been around a while. So is there have you
5 years, yeah.
yeah, have you done a
Yeah.
pivot yet, or are you looking at the
So
next,
the
or are
thing
you
I
right in
would
the
say,
sweet spot?
Ken, I think we've got our niche, right? We've really
Yeah.
got something special. But I think the thing that we might be looking to do next is adding on some referral partnerships. So when we identify a member who isn't appropriate for a group, someone who does need a higher level of one-on-one
Hmm.
care, rather than just having that hard conversation and saying, here's a link to find someone in your area, it would be such a smoother handoff if we could say, hey, Ken, Jody is our referral partner and she's going to help you find, insert partner name therapist. So that to me is the next evolution for us.
Interesting. Yeah, find somebody like you guys, but
Yeah,
outside the group space, and really
right.
focused on real, like you said, the real serious cases.
But the
Yeah,
challenge then becomes what we've already talked about is, do you have the bandwidth and the capacity to take people almost immediately, right? Because we're offering immediate same day care.
yeah.
Is this person going to have to wait weeks or months for you to step in?
What about another decent sized telehealth company?
No, I'm talking about those players.
Yeah,
Yeah, I'm
that's who it would be. Yeah,
even for them. Yeah,
yeah, yeah. That's who it would have to be.
yeah,
Yeah, it's an interesting. Yeah, it's an interesting idea. It's a good way to solve it, and I do see that as one of the outcomes. Okay, what else happens in the groups? You've got the um,
So we have a really interesting group I like to tell people about. We have a couple of we call them art, music, and movement groups, which are just like they sound. It's healing through an activity more than healing through discussion. So there's one called using writing to process emotions, where you might be given a prompt and then you spend 10 minutes quietly writing, and then the rest of the 20, 30, 40 minutes talking about, what you wrote, sharing about why that's meaningful, listening to your peers. We have a yoga one. We have one on, art, where you're actually prompted to draw something that relates to what you're going through and process that way. So I like that too. There's variety depending on how you like to heal.
that's kind of cool.
Yeah.
Very.
Yeah.
So that's a very different approach. I guess you can do that with this format.
Yeah. Yeah, you can. And
So yeah,
these
you can be
therapists that
pretty.
are leading those sessions are duly certified, right? They're certified as a licensed therapist, as well as they have, a background in yoga or a background in art or insert any of these trainings. So they are qualified to be leading you through that experience.
Very fun. Yeah,
Yeah,
now
it
that's
is.
something that is really different. I love that.
Yeah.
Um,
Those are some of our more popular sessions, I'll say. So it's hard. Those can be a little bit tricky to get a seat in, but we've been adding more and more options or times and dates for those because they are popular.
well, I think you want. Uh, I mean, one of the challenges with any app or any service like this is to get people on the platform, right? To get
Yep.
them engaging with the platform at
Yeah.
least on a daily basis. So if you've got classes that are kind of
Hmm.
fun classes and they're not where I'm going to go kind of, I got a little, maybe even a little apprehension. I'm going to go
Sure.
right.
Sure.
And I've got a session at 4. It's about grief. We're going to talk about so and so, and that's heavy, and I got to get my head around that. But I got this kind of drawing or prompt response class,
Yes. Yes.
and I meet, and that would be, and it gets you back. Like I said, it gets you to the platform,
Hmm.
and then maybe I do kind of just poke around. I poke my head in one of the
You're
sessions.
like, well, that was, and we have lighter, I would say we have lighter options if you're a little apprehensive or unsure or new to therapy as a model. We have just like setting your weekly intentions, right? So having a Monday class in the morning that's like, okay, what do I want to accomplish this week? What is my focus for the week? Or midweek mindfulness, where you're just kind of getting grounded again. And those sessions I would say are also on the lighter end, not like the trauma, grief, addiction sessions,
Right.
which are
Yeah.
obviously going to be a bit heavier.
Yeah. Yeah. So I mean, I think
Yeah.
it's cool if you've got that light in there. then you don't really have to make progress, or just there's no pressure, there's no homework. You just kind of go and chill, or like I said, or just do a Monday intention setting. How cool! How
Yeah.
great!
Yeah.
I think that's one thing. Reflecting on the insurance career and sales in general, kind of hardcore sales,
Yeah.
going through a lot of training around rejection, expecting rejection, facing rejection, the numbers, working the numbers, not, the emotion about, somebody saying no, or get the fuck out of here, or chasing you out of the building. You just kind of learn to let that go. It's not you learn what's personal, what's not personal.
Yeah.
And you also read a lot of stories of inspiration and mindfulness and goal setting. So, I mean, I was I was definitely given some bulletproof vests for parts of my life,
Right.
in those early sales, roles, and just
And
that
everybody doesn't
positive.
get that. We probably could all use that, right? But
No,
everyone doesn't get that.
I think everybody absolutely needs to do. First off, everybody deserves that chance. I was super lucky looking back on it and looking back through the jar journey, seeing I was lucky because I mean, I got over some stuff, and a lot of it was those early, hours of cassettes, Zig Ziglar. Everybody should be required to listen to a Zig. If you don't know who Zig Ziglar is, you got to go Google
Look 'em
him
up.
and get on YouTube and come back in 2 days when you've got some Zig in your bones.
Yeah.
Anyway, these kind of just great, inspirational people who overcame a lot and did it with a powerful mindset. That's not obviously going to fix everything in life, but it definitely can keep you, from hitting the speed bumps as hard, I think. And, you hit 6 speed bumps so hard in a row, and you might need to go see somebody.
Sure.
But if you got a little bit of that, hardcore sales training, you might take them a little bit lighter. So yeah, like I said, everybody should go do some cold calling in life. It's the great.
I've had so many people say everyone's got to carry their bag. You got to carry a bag and ask for a check at least a year in your career. Otherwise, you're just, you're not the real deal. But that's a hard thing. That's a really hard thing.
I sold calculators door to door down Sunset Boulevard.
Wow.
I got a whole story around that. It's been, Lauren, it's an awesome conversation.
Thanks, Ken.
It really, I mean, you found yourself in such a cool place. I couldn't imagine.
I couldn't agree with you more. Every day I wake up and it's not rainbows and butterflies, but the challenges are easy to want to solve because I know we're doing purpose-driven work.
Yeah, I think that's it. When you're trying to solve problems and things get sticky, it's like, we can probably reach another couple hundred people today.
Yeah, let's do it.
Yeah, that's a beautiful thing. How about some closing thoughts? Could be a message to somebody, could be, future self, past self, could be to me, starting a foundation. Any advice?
Yeah, no, I think just in general, as someone who didn't struggle with mental health until last year, I would just say mental wellness doesn't look the same for everyone. It doesn't take the same amount of time to find. There's not a one size fits all approach. And so just find what works for you. Yeah,
I love that. That's really, and that is powerful. Find out what's going to work for you. Put your hand and, reach out. I think it is I like to remind people, reach out. If it's dark, put your hand out, stretch your fingers out. There's probably somebody next to you just as lost in the dark right now, looking for a hand to hold. Again, thanks, Lauren. Really cool stuff what you're doing. I'll absolutely going to download the app and keep in mind.
Yay!
And sign me up.
Let me know. I can get you a code. You can try it for a month or two for free. Let me know what you think.
Oh, absolutely. I want to try it. Hook me up with a code. And then, get me a sales rep job. I'm going to be out here banging some doors.
You're the guy. I'm
going to go close some deals. I'm excited. Okay. I'm excited to give me 2 brochures and a what'd you say? A bag and a checkbook.
Yeah.
Or deposit.
Give me the money. Yeah. No, that's awesome. Thanks, Ken, for the time and just the audience. It's been really nice.
Yeah. Thanks everybody. Thanks for listening and supporting the JAR Foundation for sure, and as well as JAR Podcast. You can find us really on all the platforms. This show is going to record and be posted live on Facebook. It'll also be on YouTube and here on LinkedIn. And then give us about 4 or 5 days, or about a week, Lauren, and we'll be up on the regular audio only platforms.
Wonderful.
Okay, and then let's find a little. Let's see if we can do one more. We even got a little exit. Let's do an exit one. Just kind of
awesome.
Why have I quit my job? Why have I, bought a van? And why am I going to drive around the country? Well, I'm passionate about the idea that you need to be heard. And I want to stitch these stories together across the states. We're going to find the commonalities. And it's going to be really an amazing experience. And I look forward to you joining me on the JAR.